This radiograph gives us a frog leg lateral view of the pelvis of a skeletally immature male patient. The first thing that jumps out is the clear and smooth contour of the right femoral epiphysis. It looks normal, nothing too concerning there. But when we turn our attention to the left side, we see a different story. There is clear medial slippage of the left upper femoral epiphysis, which is a textbook feature of a slipped upper femoral epiphysis, SUFE. The epiphysis itself still maintains a smooth contour, which is important because there are no obvious signs of a vascular necrosis at this stage, which can be a feared complication in such cases. Now, we must remember that in cases like this, the urgency lies in promptly addressing the slippage to prevent further displacement and complications like a vascular necrosis or condylosis. I would want to engage with the orthopedic surgical team as soon as possible to ensure this patient receives the necessary intervention, likely surgical pinning to stabilize the epiphysis. Also, given that SUFE can sometimes be bilateral, it's important to keep an eye on the right hip even though it looks normal for now. I'd advise either a follow-up or perhaps imaging both hips just to rule out any impending issues on the right side as well. Now, if this were the Viva exam, the examiner might want to test my awareness of the common presentation of SUFE. So I'd be prepared to answer questions about its frequent occurrence in overweight prepubertal boys and how it can sometimes present subtly with things like knee pain, which can throw off clinicians if they're not thinking about the hips. Another follow-up question could be about the complications, as I've mentioned a vascular necrosis, but would also discuss leg length discrepancy and the importance of timely intervention to minimize these risks. Finally, I'd wrap up my discussion by stating that this is an orthopedic emergency, and my next steps would be getting orthopedics involved urgently and ensuring the patient has no contraindications for surgery. Of course, if you're watching this and enjoy these case breakdowns, don't forget to hit the subscribe button, leave a comment if you have any questions, and share this video with anyone studying for their FRCR exams or anyone who just loves radiology.